Hi everyone, welcome to another episode, I guess. We are joined today again by the amazing Dr. Orin, and we've got a really fabulous topic that I'd love to discuss with you guys today. Would you like to introduce yourself?
Yeah, sure. I'm Ori. I'm a counselling psychologist who specializes in perinatal mental health. And yeah, really glad to be here today.
Perfect. Thank you so much. So today's topic is bipolar disorder within and outside of pregnancy. I'm just going to go in straight ahead with the first question. And can you please explain to me what bipolar is and how it can manifest in individuals?
Yeah. So bipolar disorder, I guess the way I'd want to explain it is that I guess it's about extremes of mood or emotional extremes. So, and they're different types of bipolar. So I'll just go through them. So typically it's characterized by being in a state of sort of mania, and so that's where you're extremely elated, might have quite grandiose thoughts or sort of like about what you can achieve or what you can do. Sometimes people would not really feel the need to sleep, to eat. So we can all feel elated and we can all feel happy and energized, but it's at an extreme. And
Right.
in that place, sometimes people can get to the point where they make decisions, so they spend large amounts of money, and I mean decisions that can cause quite a lot of harm and damage. They might spend quite a lot of money or do things impulsively that when they're not in that state they wouldn't do. So it's
Right.
it's a disorder of emotional extremes is how I would describe it. So some people can have bipolar one, which is what they have is the mania bit. So when you might have heard it called as like being manic, so the mania bit, and then at other times their mood might be more stable. And then there's bipolar 2, which is more where you have depression and you have the mania. So that's where the extreme is. So you can have extremely high highs or really, really low lows. And then you can have bits of like times of being stable in between as well. And for some people that might present as they go from the highs to the lows quite quickly, so they're moving between them quite quickly. And for some people it's more around them, they have like mixed features of it, so they might have highs, but they're also experiencing the low at the same time as well, or certain features of being low as well. So that's what it is. It's quite a serious condition that needs to be managed, especially when you think about it in the context of pregnancy, because when somebody's in a state of mania or they're manic, then they can end up doing things they ordinarily wouldn't do that can be quite risky. And then when somebody's in a state of feeling extremely depressed or extremely low, they can also end up becoming quite suicidal. And so there's a higher risk of suicide with people who experience bipolar disorder, because the lows are so low,
Wow.
in comparison to what somebody who doesn't have that condition has.
Mm.
Yeah.
Okay, wow. I didn't, obviously, it's serious, but I didn't realize how it can kind of affect you during pregnancy. Um,
Mm.
how does it typically affect women during pregnancy? I know you've obviously mentioned that you can have
Mm-hmm.
really high highs and really low lows, and that can sort of affect if you're suicidal. Does it show up in any other ways during pregnancy?
Yeah, I think during pregnancy, I suppose it's more what the thing to kind of think about is more about, I guess I'll talk about sort of like the mania of being manic. Is more if they're not sleeping, they're not eating, they're not, because the effect in pregnancy is that you have to consider that there's somebody else involved in the impact of your decisions. It's not
Yeah.
just that person, it's also the unborn baby. So if you imagine the kind of the toll that might take on the body if somebody's not sleeping or somebody's not eating properly, or they're engaging in potentially risky behaviors, whatever that might look like. So I mean, it's hard to kind of prescribe exactly what that would look like for anybody, but if somebody in a state of mania would go on like a drinking binge or something like that,
Right.
it's, I guess it's thinking about the physical and I guess psychological impact of the stress that puts on the body, on the baby, as well as the conditions that the baby is growing in. So I think it's a lot more risky during that time, and it really needs to be managed. And I think the other thing is that with bipolar, it can sometimes be accompanied with features that are psychotic in nature. So sometimes people, and when I say psychotic, they might have they start to have unusual ideas that
Mhm.
most people wouldn't have, and they can sometimes have those unusual ideas about their baby and what their baby represents, and it can become quite sort of not typical, the types of things people can think about their baby, and sometimes they can kind of have feelings of their baby might the baby might be something, some sort of like foreign thing inside their body, like they just have unusual ideas about their baby that are not conducive to the bond between the
Right.
parent and the child,
Mhm.
as well. So I guess in pregnancy it's just about managing the risks and being aware of that. It affects people the same way it would affect somebody who isn't pregnant, but it's just that added risk,
Yeah.
really.
Of there
Yeah,
being another human to think about.
yeah, yeah.
And what about outside of pregnancy when you've had your baby, your child,
Mhm.
what does that potentially look like?
Yeah, so people with mums with bipolar disorder would often be under a perinatal team because of the risk.
Okay.
So that's managed, and they would have like a pre-birth care plan with the perinatal team, and then they're like consulted obstetrician if they're under that type of care, just to kind of manage the risk. But after having a baby, the thing is that if you have bipolar, you have a higher risk of becoming psychotic and having postpartum psychosis. So it needs to be managed really, really well, because you can come really, really unwell. And again, with postpartum psychosis, I'll just quickly say that's characterized by maybe having hallucinations, so seeing things, hearing things, experiencing things that are not there or not real or other people are not experiencing, and also believing delusion, so believing things that other people wouldn't typically believe, and often that would be related to the baby as well,
Right. Okay.
which can become quite risky depending on the nature of those sorts. So you need to really kind of manage the condition, during that time. And there's other things you need to kind of think about, because I suppose we don't know exactly what causes bipolar. I mean, there's some genetic, people who have a family history of it are more likely to have it as well. But there is something that there's some idea that there might have something to do with sort of like hormonal or chemicals, chemicals in the brain, or an imbalance in some way. So in terms of how it's managed, often people will be on medication.
Yeah.
And a typical, I'm not a psychiatrist or a medical doctor, but I can tell you what I know. But typically people would be prescribed lithium to manage bipolar disorder after they've had a baby, and also during pregnancy as well. But again, that has to be managed in terms of the risks of transfer of taking
Yeah.
lithium whilst pregnant. So that would have to be
Yeah.
managed. But typically, people will be prescribed lithium or some sort of mood stabilizer, basically to help keep their mood stable.
Okay.
But it's just because giving birth is just a really like risky time, because of the level of stress your body goes through in giving birth, and then just the level of psychological stress of making that transition to, especially if it's your first baby, to not being a mum to being a mum as
Hmm.
well. And then the sleep deprivation as well is a risk factor for people relapsing with bipolar disorder, and maybe
Right.
going into that mania or going into more of that depressive state as well. So it's very kind of much about risk management. Medication, you can also have talking therapies as a way to manage your symptoms as well. And then there's also often your psychiatrist will also give you sort of lifestyle advice as well. So thinking
Mm.
about how much sleep, what your triggers are, getting into the pattern of managing, like monitoring your mood, knowing what your warning signs are, knowing the things that make you vulnerable. I think I don't know if you mentioned earlier or not, but even thinking about hormonally as well. So like when you might be more at the time of your month, like all of those things have an impact, and there'll be different things that make people more vulnerable to going into a manic episode or a
Hmm.
depressive episode or not. So it's about knowing what those things are and managing those things during pregnancy, but also after, because
Yeah.
of the risk of psychosis, becoming unwell,
Right.
quite unwell. Yeah.
Okay. Gosh, wow, a lot to think about there.
Mm,
But thank you for answering. 'Cause that was my next question about
mm,
like treatment and
mm,
medication and how does that really work? But
mhm.
you've answered that perfectly. Thank you very much.
It's okay.
Um, so what are the potential challenges or risks associated with bipolar disorder during the postpartum period? So we've kind of briefly touched on it during whilst you're pregnant, but what about after?
Mm. Yeah, so the risks, I guess I can talk a little bit more about the risk of postpartum psychosis and like how that can really, because that's a major risk,
Okay.
really, of when I say major risk in compared to the general population who don't have this condition is what I mean. But that is a risk. We have to be really mindful about that, because sometimes people can, I would say, yes, the risk of psychosis, but I think also the suicidal risk as well, because
Right.
with the Embrace report, we found that suicide is one of the leading causes of
Yeah.
death during that sort of perinatal period as well. So
Yeah.
if somebody has a condition that puts them at elevated risk of suicidality, then that's something that really needs to be thought about. So I would say those are the main risks: is the risk of suicide if somebody's mood is not being managed, or they've come off their medication but nobody knows that they've come off their medication, or our family members saying don't take your medication because the baby, and all of those kinds of things. So it
Right.
has to be very much like a whole system approach. So kind of, you're not just working with a person, you're also working with the people who are kind of supporting them to
As
encourage
well.
medication compliance, and like that they're doing the things that help, that are, they're engaging whatever their protective factors are that they've identified that help them keep their mood and stable. And then, like, yeah, a lot of risk management is also involved in sort of not just to the person but also to the baby as well, because sometimes people can have quite difficult thoughts towards their baby, or they're thinking that their baby wants to harm them, or that their baby might be evil, or you're
Right.
not really the baby, and like these unusual ideas that come with that. And so because of that, because of those beliefs, somebody can then end up doing something harmful, not because they want to harm their baby, but it's because of what they're thinking and
Yeah.
what's
Yeah.
going on in their mind. And so you do get awful stories of when things go really, really wrong, unfortunately. So it is a serious condition.
It's quite serious. Yeah,
Yeah.
it sounds like it's quite serious. And I
Mm.
guess you would probably know before you go into pregnancy that you're bipolar, but are
Yeah,
there
probably.
instances where someone gets pregnant and then becomes bipolar? Like, is there a risk of that? Is that something you've ever heard of, ever dealt with? Like,
um I haven't ever come across that or heard of it. I'm sure it's possible, but I guess that would just be more it was undiagnosed up until that point.
okay, fair enough. Fair enough.
Probably. But I've never heard of it. Like in the team I work in, most people we already know that they have bipolar before they
Bipolar. Okay.
they before they become pregnant. And there's a lot of, like, preconception counseling as well when somebody with that condition decides they want to have another baby, just to think about the risks and all of the things they may need to put in place with that, and
Okay.
the stress that it will take them under. But I think people can have sort of like relapse
Mm.
during pregnancy, in terms of maybe their mood had been stable for a while, because it's not like people are in a state of mania and depression necessarily all of the time. They might just have it at certain points of, sometimes it can be kind of predicted, sometimes it can't be predicted. So if somebody's maybe been quite stable up until that point, becoming pregnant and having a baby can trigger them maybe into a state of mania, or trigger them to really become really, really, really depressed um, as well. So yeah, it's just about the monitoring really that
Wow.
needs to happen on the healthcare professional side of
Yeah,
things
as
as well.
well. Yeah. Because I was gonna say it's a bit different to sort of something like maybe postpartum depression
Mm.
where maybe someone hasn't experienced that before, but
Yeah,
outside of all of that, they realize that they might have this. But
yeah.
I think bipolar is probably one of those things where you had before and then it could get triggered or it could get worse or something like that.
Exactly,
Get
yeah. I
pregnant.
think yeah, I
Yeah.
think typically people tend to be first show signs for it when they're probably like adolescents.
Mm,
Whether that gets picked up on or not, but often it's not something that, I think, yeah, it's something that's kind of already been there for a while.
okay. And pregnancy can heighten it, but it
Yeah,
doesn't
pregnancy can
it
happen because
doesn't
of
right.
the stress of it. And I think that's the thing, stresses, like significant stresses are risk factors for it, for the
Mm,
relapse or going into an episode. So
yeah.
that's
And
why.
hormones and stuff like that.
Exactly, the hormonal changes, all it's a lot for the body and the mind to process and digest, really. So yeah, but just to say, there are some people who have bipolar and they're fine during their pregnancy. They're able to be stable and they're able to be stable after. It's not like if you've got bipolar, you're definitely gonna become
Definitely gonna
unwell. No, no, it's
right.
not that. But it's just, yeah, people can be stable.
Okay. And I guess probably the one of the last questions will be it you probably will know if you have it already, but where would you go for support and for help, and what are the resources
Mhm.
available and stuff out there?
Yeah, I think if you're noticing, you're not diagnosed and you're noticing that you're having sort of extreme mood swings and things like that, that it's important to speak to your GP. Would probably be the first person you would go to as well. Just to kind of, I think the thing is with the bipolar is that it can take time to be diagnosed, because there's lots of conditions that have mood swings as part
No.
of that.
Mm-hmm.
So you need somebody who really knows what they're talking about, to who really understands it, to really be able to diagnose it, as well. But it would start off with your GP, and then they might refer you to get an assessment, or with a psychiatrist or something like that. But that would be the first person to speak to. There's also a charity called Bipolar UK, and so they have lots of information, lots of resources about bipolar, and they raise awareness about bipolar. So that if you're like, I'm not sure, might I have it? That could also be a good place to just kind of get a sense as to whether what they're saying on their website resonates with you, and then you can kind of also have done that research and take you to your GP and say, I'm wondering about this, as well.
Mm-hmm.
If you've got the funds, you can also do this privately. Of course, you don't have to wait to go to your GP, and go through the different pathways and all of that. It can take some time really to get those diagnoses, um, as well. So yeah.
Okay, perfect. And I guess, are there any final thoughts you had on bipolar within pregnancy, outside of pregnancy, that you wanted to leave with our audience today?
I would just say that people recover, like people can recover in the sense of, I mean, with bipolar, it's normally a lifelong condition. It's not necessarily something they will never now have a manic or depressive episode again. But what I mean by recovery is that people can be well, people can lead good lives, even with depression. People can recover from depression. You might have a susceptibility to it, but people do get better. Even people who might go on to develop postpartum psychosis as well, often like if they get the right treatment in a timely fashion, they recover,
Mm.
and they're okay, and they can thrive. So I guess I just want to leave a message of hope, that it's not all, I mean, these are difficult things we're talking about, but it's not all sort of like bleak, and that there's nothing that can be done. There's lots that can be done. There's a huge amount that can be done. So just to, I guess, hopefully have a bit of that hope, especially if you're at the beginning of the journey of something not being right and trying to find the right support for it.
Perfect. Well, thank you for today.
You're
Um,
welcome.
and yeah, thank you all for listening, and we'll see you in the next episode.